Good morning, my dears. Today's topic is on HIV AIDS. The term HIV, it's an acronym. So the expansion for this acronym is Human Immunodeficiency Virus. And AIDS is also an acronym, which means the expanded form is Acquired Immunodeficiency Syndrome. Let us go into the topic today. Human immunodeficiency virus. Human, why the term human is given? The reason is that the virus can infect only human beings and it can be segregated or isolated only from human beings. Hence, human immunodeficiency virus. And the next I stands for immunodeficiency. How this virus makes a person to suffer from the disease. What is the mechanism? It is by attacking the defense mechanism of one's body, or it's by destroying the immune cells of the victim's body. So either it decreases or weakens the body's ability to fight against infections and even cancers. So as the immune mechanism is weakened, even simple organisms, commensals, or an infection, a virus or a pathogen, which cannot lead to the disease manifestation if the person is hale and healthy. But if he has immunodeficiency, then the simple pathogen can create a disaster or the complete disease manifestation in one's body. Hence, immunodeficiency virus. Again, the pathogen is a virus. It's not a bacteria or fungus or a protozoa. Hence, it is called as HIV, human immunodeficiency virus. So we know what is HIV. And next is Acquired Immunodeficiency Syndrome, that is called AIDS. The acronym is AIDS and the expanded form is Acquired Immunodeficiency Syndrome. A means acquired, which means this we only acquired. The virus doesn't come on its own to attack anybody. It is we only invite the virus, we only get the virus. And it is not caught as like droplet infection. When a person having a upper respiratory tract infection, coughs or sneezes or kisses someone, the same pathogen through fomite or through active droplet nuclei itself, it can enter into others' body. But this AIDS or HIV, only when the person allows him to acquire, the organism enters into the body. So that is called acquired immunodeficiency. This is already explained. So as the virus weakens the immune system of one's body, it is called as immunodeficiency. Syndrome means it's a complex of manifestation. So it doesn't affect a particular system. It can affect one or many systems at a time. And it can have one or many signs and symptoms clustered together in an individual. Hence, it is called as syndrome, acquired immunodeficiency syndrome. And next is this term HIV is not simple. It's a pandemic. Pandemic means the disease is present in almost all the continents of the globe, of the earth. So then it becomes 2 or more continents is involved. Then we call it as pandemic. Epidemic is outbreak of diseases in a particular place, may it be a state or province. It's an epidemic. Then endemic is continued presence of disease in a community. That is endemic. Malaria is endemic in India. So whether the season shifts from one to the other, or whether the economic status, it is there continuously in a community, but in a controlled manner. That is endemic, in an expected figure, expected number. Epidemic is outbreak of the same disease in an out of proportionate aspect. So then it becomes epidemic. But again, this outbreak is constricted to one state or one province. And pandemic is that when the same disease affects almost 2 or 3 countries of different continents, or all the continents of the globe, then it becomes pandemic. Yes, HIV is a disease of pandemic nature. Earlier, 50 years back, this disease was not known to us. Only since 50 years, we are knowing about this disease, and the disease is being progressing, and there are many research works are going on against this infection. So this like diseases like leprosy, tuberculosis, we have history since decades and history since centuries. So even the presence of leprosy was documented in Bible, which means before the birth of Christ. And tuberculosis, similarly tuberculosis, there are certain diseases which has been documented since centuries and millenniums. But whereas HIV is a new disease which is in the community, which is in the globe since 50 years, that is half a century. And that is otherwise known as modern pandemic, HIV pandemic or modern pandemic. Then we'll discuss about the routes of transmission of this virus. So through what routes it gets transmitted from one person to another person. Next is window period. Window period, you would be aware of the term incubation period, and let us know about window period in HIV, which is important for HIV infection. Then the stages of HIV infection. So we have, like, according to the disease manifestation, the infection can be staged. Early asymptomatic stage, symptomatic stage, and then with all the symptom complexes. So that then late infection stage. And from then, the person goes for death. So what's the difference between HIV infection and AIDS? Not all infected individuals will exhibit the disease. Infection is just the entry of organism into one's body, that is infected individual. Or not all infected individuals will suffer from the disease. So when their immunity is sound, the disease will not evolve. The stage will be static at the infection stage only. When the person's immunity is reduced or the defense mechanism is drastically impaired, then the person goes for getting the signs, symptoms, all the infections that can occur opportunistically, that can progress to the disease and the full-fledged AIDS syndrome, that is acquired immunodeficiency syndrome. So this infection and going to AIDS stage is mainly because of the CD4 helper cell count. So actually, on an average, every individual has a CD4 count of between 800 to 1200. So this CD4 count is for normal individual. So the normal count in an healthy individual can range from 800 to 1200. So what happens in HIV infected individual? As in when the HIV is infected, HIV is entering into our body, this virus will stick on to the CD4 helper cell surface, that is a receptor. And this virus will inject the viral RNA into the CD4 helper cell after integrating with the cell surface. Once when the viral RNA enters into the CD4 helper cell of the host, what happens? With the help of reverse transcriptase enzyme, that viral RNA will be converted into viral DNA, and this DNA, viral DNA, will integrate or join with the host DNA with the help of the enzyme integrase. And what the host cell will think, okay, this is our DNA only. So it starts producing proteins and RNA as dictated by the viral DNA. And hence, many such mRNAs of the HIV virus are transcripted and from then translated. And all the amino acids which are transcribed will be packed into polypeptides, and then it will be converted into many such viral RNAs. So this virion will be extruded from the, or they will get extruded from the CD4 helper cell. Many such thousands of copies of HIV viral particles will be extruded into the bloodstream after destroying that CD4 helper cell. So this CD4 helper, this virions which are extruded will evolve into HIV particle, HIV virus, individual HIV virus, and this virus will go on infecting or attacking the other CD4s similarly, and they go for replication, thereby destroying many such CD4 helper cells. So what happens in the host is the CD4 count will get reduced day by day from 800 or say 1200 to 500 or 300 or sometimes less than 50. Sometimes the person can go for 0 also. So that is the course of HIV infection and the evolving of AIDS, that is acquired immunodeficiency syndrome, the disease problem. So now you got to know the life cycle of HIV virus inside an infected individual. Next is, we'll discuss about the HIV epidemics globally, regionally, and locally in terms of the number of people affected. That is the burden of disease in the population with respect to the local community, regional, that is state-wise or province-wise, or globally, the country-wise. So globally, and during the start itself, that is 1970 itself, there were about 50 million cases of HIV. And in India alone, there are more than 5 million cases of HIV. And among the different states, so we have grouped the states into high prevalence states, moderate prevalence states, and low prevalence states. So high prevalence states are those which have the HIV incidence or prevalence more than the expected number. So the target is when the HIV infection rate is more than 5% in general population and more than 1% in antenatal women, that state is said to be a highly prevalent state. Then moderate prevalence states are those where the statistics is like this. The prevalence of infection among general population is more than 5%, but whereas the prevalence of infection among antenatal mothers is less than 1%. Low prevalence states are those where the prevalence of HIV infection is less than 5% and prevalence of HIV infection among antenatal women is less than 1%. The high prevalence states are Maharashtra, Karnataka, Tamil Nadu, Andhra Pradesh, Manipur, Nagaland. Mainly in Manipur and Nagaland, northeastern states, the reason for this active transmission or the high prevalence is the high incidence of intravenous drug use. And then the moderate prevalence states are those Goa, Gujarat, Puducherry. The rest, all other states are low prevalent states according to the statistics. So this is the epidemics of HIV globally, regionally, and locally. Next, let us go into the term antigen and antibody. Antigen is the active viral particle which can be any part of the virus. It can be an envelope protein, or it can be a core protein, or it can be a DNA or RNA material. The antibody is the resistance or the helper cells which we elaborate against the infection or the antigen. Next is the window period. So this window period is specific or unique for HIV, important for HIV infection. The reason is that you will be aware of the incubation period, term incubation period. So incubation period means it is the period between the entry of pathogen into one's body and the appearance of the first sign or symptom in the host. So this duration is called incubation period. So this you would be knowing the incubation period for common influenza, that is the coryza, is 3 to 5 days, so which means entry of the virus into one's body and the appearance of the symptom, may it be a running nose or a sore throat or a congested eyes. So that duration may be 1 to 3 days. So that is the incubation period. During this period, patient will not be having any symptom. That is the incubation period. Entry of organism into one's body and appearance of first sign or symptom. Till then, there won't be any sign or symptom. That is disease-free period. So that period is for active multiplication of the virus inside the body to a number, to a load, so that it can produce the sign or symptom in one's body. But in HIV, it is called as window period. Window period, it can be from 4 to 6 weeks. It's quite long. And the major important thing about this window period is that similarly as like incubation period, the HIV has entered into the person's body. That is, infection has occurred. And following that infection, for a period of 4 to 6 weeks, he or she will not have any sign or symptom. So they will not go to hospital, first of all. And again, suppose within this window period, if a person is willing to go for blood transfusion, want to donate his blood, and the person will be screened for diseases like malaria, VDRL, and hepatitis B. And when they go for lab testing for screening HIV, he or she may give a negative report that is fit for donating the blood. But actually, HIV is inside the person's body. So this is the period where there won't be any sign or symptom, and even the lab test will not show any antibody positivity. But there is infection going on inside his body, active multiplication going on in his body, because antibodies are not elaborated to that extent. It gives a positive report. We give the person as HIV negative. And if the person goes for blood transfusion, there is active viral load is there to infect the recipient. So this period is called window period, which is really important in case of HIV. Next is the progression of HIV infection. So I was already saying about the CD4 cells. So the normal CD4 count is 800 to 1200. And this HIV targets the CD4 helper cell. So that is the cell where the HIV virus will intrude into, and it will convert the cellular DNA into viral DNA. And this viral DNA will make its own proteins and copies of RNA, and which will completely destroy the CD4 cells ultimately and many such copies of HIV virus are into the blood circulation, ready to attack the new CD4 helper cells. So if our soldiers, if we are losing our soldiers, CD4 helper cells like this, our body doesn't have any immunity to offer protection against the pathogens which are everywhere out in the environment. So even a simple pathogen can turn into a big infection into that person's HIV infected person's body. So that is called progression of HIV infection. So this progression will not happen in a day or a month. It will take years. So it can take 3 to 5 years for the person to go in for clinically symptomatic stage. So that is the long incubation period for HIV. And then followed by progressive decrease in the CD4 helper cells and progressive increase in the infection rate and severity of the infections, then going for total immunodeficiency and succumbing to the, that is, morbid infection. So we have seen what is HIV and AIDS, the HIV pandemic or the modern pandemic, the routes of transmission of HIV. So the HIV virus can get transmitted from one person to another by means of percutaneous transmission. So the needle prick or any soiled material from HIV infected person inadvertently pricks the other person, like a housekeeping staff or the nursing staff or any other healthcare worker, very prone for getting the infection. Even IV drug use. When a person is already infected with HIV, shares a needle to another person for sharing the drug, he also shares the HIV which is present in his body. So that is percutaneous route of transmission. Then sexual transmission, men having sex with men, or heterosexual transmission. So this is also possible. Another way is transplacental, mother to child transmission, and then transmission through breastfeeding. So these are the routes of transmission, different routes of transmission in HIV. Then we have seen the window period, 4 to 6 weeks, where the person will not have any signs or symptoms. And even antibody testing will be positive, negative in that period. And that is called window period. And another important feature of this period is that active replication occurs during this period and the person goes for spreading the infection without his or her knowledge. So this is window period. And the different stages of infection from early to late stage, mild to severe stage of infection. And this is the structure of HIV virus. So the outer and red and orange one is the envelope protein and the core protein, that's P24 antigen, then followed by RNA, and the round ones are the reverse transcriptase. So this reverse transcriptase is an important enzyme which is responsible for converting RNA into viral DNA, which will mimic like host DNA and gets integrated with it and form viral DNA copies, and then followed by extrusion of viral RNAs. So this is the structure of HIV. HIV is the virus that causes AIDS. Not everyone who is infected with HIV has AIDS. Yes, exactly. So AIDS is the disease progression, disease manifestation, complex of disease manifestation. HIV is the attacking pathogen. Infection, not everyone who is infected doesn't mean that they have AIDS. Only when their immunity drops, when their CD4 count drops to such an extent that they succumb for infections. Everyone with AIDS is infected with HIV, of course, but everyone who are infected with AIDS, with HIV virus, may not progress to AIDS stage. So AIDS is a result of progression of HIV infection. If one CD4 count is maintained more than 500, then the possibility of going for AIDS stage is very, very less. Anyone infected with HIV, although healthy, can still transmit the virus to another person. So that is what we were saying. Even in window period, no symptom, no sign, no lab testing positive, turning positive, but still active viral transmission is going on, and hence he can transmit the virus through sexually or sharing the needle or sharing the blood, or if at all a female, transplacentally to the fetus or through breastfeeding to the baby. So this we were saying, unprotected sexual contact with a person who is affected with HIV infection, then exposure of broken skin or wound to infected material. It can be blood or body fluids. Blood transfusion, mainly during the window period, if the test doesn't show the positivity, the person can actively get the infection. And then injection with contaminated objects, the used needles or the syringes from HIV infected, if the same thing is shared with other person, that thing can transmit the HIV infection. Mother to child during pregnancy or during birth and breastfeeding can also transfer the infection to the baby. So though we know what are the different routes of transmission, the major route of transmission is through heterosexual contact, 87.4%. So if this is avoided, the majority of the transmission cycle can be interrupted. So this heterosexual transmission, then followed by parent to child, that is antenatal mother to the child, and then homosexual, men having sex with men, MSM, then injecting, drug use, blood products, blood transfusion, and then the other ways. So the most common route of transmission is heterosexual way. And the HIV statistics among the different states in India. So the states which have the high prevalence of HIV infection are those: Manipur, Mizoram, Nagaland, Andhra Pradesh, Karnataka, Tamil Nadu. So these are the high prevalence states. So as we were saying, northeastern states, the main route of transmission was through intravenous drug use. The rest of these states are because of heterosexual transmission. Of course, the country which has the highest number of HIV cases are South Africa, followed by India. Okay. Let's go into the serological profile of HIV infection. So the starting stage is the where the HIV virus enters into the person's body, and from there, for a period of 4 to 6 weeks, the virus is actively multiplying in the host cell, host body, and then it goes for the victim's body goes for elaborating antibodies against the HIV infection. So that period, 4 to 6 weeks, is called as window period. And after depending on the number of CD4 cells which is left for the person's immunity, the person goes for mild to moderate, moderate to severe stage of infection. So window period is that time from initial infection with HIV until antibodies are detected by a single test, that is ELISA. Usually 3 to 8 weeks before antibodies are detected. So the test that may give false negative during this period. That is what I was saying. No? Like symptom also will be negative, sign also will be negative, and test also shows negative. But there is active viral multiplication going inside the patient's body, person's body. So that time, if he goes for heterosexual activity or homosexual activity or sharing the needles or his blood products to some other person, can actively transmit the infection to the other person. So the disease progression depends on the viral load, increasing viral load and decreasing CD4 counts. So as the CD4 count declines, the immune function decreases and the person goes for contracting infections and even cancers. So how can we delay the progression of the disease? So the disease, once a person is infected with HIV, he is for lifetime, he's going to harbor the HIV virus inside his body. But whether he progresses into the AIDS complex or not is a question. So we have, since this 5 decades, we have a number of drugs for managing the AIDS or the HIV infection. So these more than 20, so drugs are available. So they fall into 5 or 6 categories. Non-nucleoside reverse transcriptase inhibitors, nucleoside reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, and etc. So we can have them in combinations in order to maintain the CD4 count and in order to decrease the viral replication. So these are the 2 modes how we are going to delay the progression of the disease. One way will maintain the CD4 count so that it does not drop. Another way is that we can decrease the viral multiplication and thereby you can maintain the CD4 cell count. So that is how we can delay the progression of the disease. So we have good number of drugs, more than 20, and we can put them into combinations, 3 or 4 drugs together, and each combination can sustain a person in a healthy way for a period of 3 to 4 years, for a maximum of 5 years also. So 5 such combination can extend their life for 25 years with good level of CD4 counts. So that is one of the important boon against this HIV infection, antiretroviral therapy. And next, this is for the person who is with the active infection. So for the person without infection, we'll have to follow the preventive aspects. So that is the preventive aspects in what way? So one can primordial prevention by following good habits with related to avoiding premarital sex, avoiding multiple sexual partners, and not getting into the drug use activity like intravenous drug use activities. And then once the person turns positive, he or she should not transmit the infection to others. So usage of condoms and the healthy sexual life, like avoiding such activity itself is a big preventive measure one can undergo. And next way of transmission is placental. So we have prophylaxis for protecting the baby. When the mother is started with antiretroviral therapy during the antenatal period itself, this can prevent the infection to the baby. More than 60 to 70% can be prevented. So this is another wonderful way of preventing infection in the fetus and the baby. So these are the different modes of infection and modes of prevention against HIV infection. So hope you all understood. Let us connect with the other class with a different topic. Thank you so much.